Welcome to our educational video on insulinoma. Insulinoma is a rare tumor of the pancreas that causes the organ to produce too much insulin. This can lead to a variety of health problems, primarily those related to low blood sugar. In this video, we'll explore the causes, symptoms, diagnosis, treatment, and more surrounding this often overlooked condition. The primary cause of insulinoma is a tumor, usually benign, that develops in the beta cells of the pancreas. These beta cells are responsible for producing insulin. While the exact reason why these tumors form is not fully understood, they are typically not linked to lifestyle factors or inherited conditions. In rare cases, insulinomas can be associated with genetic syndromes like multiple endocrine neoplasia type 1 or MEN1. Insulinomas wreak havoc by releasing excessive amounts of insulin, regardless of the body's actual need for it. This constant overproduction of insulin drives glucose, or sugar, from the bloodstream into the cells at an accelerated rate, causing hypoglycemia, or low blood sugar. The brain relies heavily on glucose for energy, so this glucose deprivation leads to a cascade of neurological and other symptoms. Insulinomas are rare tumors. They're estimated to occur in about 1 to 4 people per million each year. They typically affect individuals between the ages of 40 and 60, although they can occur at any age. There doesn't seem to be a significant difference in incidence between men and women. The symptoms of insulinoma are primarily those of hypoglycemia. These can vary from mild to severe and may include a feeling shaky or weak, sweating, rapid heartbeat, anxiety, confusion, blurred vision, dizziness, seizures, and in severe cases, loss of consciousness. Because these symptoms are often non-specific and can mimic other conditions, diagnosis can sometimes be delayed. Diagnosing insulinoma involves a combination of blood tests, imaging studies, and sometimes a supervised fasting test. Blood tests will measure glucose and insulin levels, as well as C-peptide levels, which is another indicator of insulin production. During a supervised fasting test, the patient is monitored closely in a hospital setting while fasting, and blood samples are taken regularly to measure glucose and insulin levels. Imaging studies, such as CT scans, MRI scans, or endoscopic ultrasound, are used to locate the tumor within the pancreas. Sometimes, a selective arterial calcium stimulation test can be used to pinpoint the location of the tumor when other imaging is inconclusive. Insulinomas are generally classified as either benign or malignant. The vast majority, approximately 90%, are benign, meaning they are not cancerous and do not spread to other parts of the body. Malignant insulinomas, also known as insulinoma carcinomas, are rare and can spread to nearby tissues or distant organs. The primary treatment for insulinoma is surgical removal of the tumor. In cases where the tumor is small and well localized, it can often be removed laparoscopically, which is a minimally invasive procedure. If the tumor is larger or has spread, a more extensive surgery may be necessary. For patients who are not candidates for surgery, or for those with malignant insulinomas that have spread, medications like diazoxide or octreotide can be used to suppress insulin secretion and manage symptoms. Chemotherapy or targeted therapies may also be used in cases of malignant insulinoma. Currently, there are no known preventative measures for insulinoma, as the exact cause of these tumors is not fully understood. Early detection and treatment are crucial for managing symptoms and preventing complications. The prognosis for patients with benign insulinoma is generally excellent, with a high cure rate following surgical removal. The prognosis for patients with malignant insulinoma is more guarded, as the cancer can spread and be more difficult to treat. However, with advances in treatment options, even patients with malignant insulinoma can experience improved outcomes and quality of life. Recent research is focused on developing more targeted therapies for malignant insulinomas and improving imaging techniques for early detection.